Welcome, everybody. I am Dr. Andrew Neville, and we're going to be talking about anything and everything that is and isn't adrenal fatigue today in our live Q&A, both on YouTube and on Facebook, soon to be hopefully on other platforms as well. So I just want to work out a couple technical kinks here, make sure my crew gets to me and says that we are good to go on as far as tech goes on both YouTube and Facebook. So if you guys could reach out to me and let me know. As you join in, certainly give us your name and where you're coming from. We're always curious. If you have questions and comments, certainly put them in the comments section. My team of coaches is amazing, Suzanne especially, in working on those comments and questions. What else? These Q&As are open to the public. So we're going to talk about kind of generalities. Obviously, I am not your doctor. I can't give you specific recommendations with regard to medical advice and things like that. But in general, we can talk about everything around and surrounding adrenal fatigue for sure. As always, you want to check with your physician before, doing anything or engaging in any kind of protocols. So this is education, right? We're trying to talk about adrenal fatigue, what it is, what it isn't, why your doctors don't understand really what it is, and kind of in general how to work with all the various symptoms and try to put those pieces of the puzzle together. There are tons of misunderstandings, right, and myths with regard to adrenal fatigue that hopefully we can address. So again, as you join in, just hit, let us know who you are, right? Give us your name, where you're coming from, and we will jump in. I've got a list of questions that we go off of, but as you have questions on the fly, just put them in the comments. We're going to get to, I've got a few different programs that I run for patients with this. They tend to get priority seating. So I'm going to start with some of those questions first, and we will go from there. So without further ado, let's jump in. Let me just check, make sure we're okay. Yep, looks like we're okay. Okay, so Lori says, and Lori is in, Adrenal Healing Jumpstart. Okay, so Lori says, are your creosote levels high with this? I thought creosote was like a carcinogenic, crusty thing when you burn stuff on the grill. So I don't know, maybe it's a typo or something. I don't know that you can measure or people have creosote levels. So not sure what to say to that. Lori, sorry for the misunderstanding there. Can't answer that. Don't know anything about that. All right. Kim says, I am on, a little harder to read. I'm on Manjaro for weight loss. So this is a GLP-1 similar to, we've got the Ozempic and semaglutides, all these various different things to work on weight. Should I stop taking it while I'm getting treated with adrenal fatigue? Give my body a rest from it. My doctors won't advise me. Thanks. You probably don't have to. The GLP-1 the GLP-1 is not going to put stress or extra pressure on your adrenals. Certainly, we deal within adrenal fatigue. It causes a ton of symptoms, and one of those symptoms certainly is weight, whether it's unexplained weight gain or just weight issues. And the weight issue is far beyond just this balance between calories in and calories out. There's a whole lot of metabolism that has to happen in between there. And that metabolism is really governed by your mitochondria, right? Little energy producers in the cell. They take energy from food, turn it into energy we can use to do stuff, to burn fat, whatever. But working with your adrenals and your thyroid, telling it what to do. And all that's broken when you have adrenal fatigue. So I get the weight thing. I'm always cautious chasing after the weight with patients. So, you just want to be a little cautious with that. Some people do caloric restriction. Well, that's stress. So I've seen people do that and then they end up gaining weight. Other people push exercise and chase after exercise too much. And that can be problematic as well, because Exercise is a stress as well, so that's a challenge for people. Really, we got to fix the metabolism. All that said, that med is not going to put undue pressure on your adrenals. It's really fine. You tend to have to fix the problem at a deeper level, though, to really fix it. Because my guess, and these are new drugs, right? So we don't have research yet, but there's going to be rebound weight gain when people stop these things, likely. So, but not or less so if we fix that underlying problem. So that really is the key. Okay, Eva says, do you have any good tips for keeping stress overstimulation levels to a minimum while flying on an aircraft or at the airport? Seraphos doesn't seem to help at all. I was curious if there was another option. Okay, so what adrenal fatigue is, and this is kind of for everybody, not just you, Eva, but what adrenal fatigue is really a dysfunction within your entire stress response system. Yes, that includes your adrenals, but there's also other stress hormones. There's the nerve side of your stress response, and then there's this limbic system in the brain that calls the shots. And for deeper explanations of that, I would send you to my YouTube channel where I talk about that stuff ad nauseum. But that's what it is, right? A dysfunctional stress response system, which means it's trigger happy. So what that means is minor stresses don't generate minor responses anymore, major responses, right? Our stress response is making mountains out of molehills. So we get trigger happy. So what do? We do everything we can to kind of calm that system. And Eva, in Healing Jumpstart, you'll notice the basic recommendations of, trying to race. That's rest and pace together. Trying to rest and pace, trying to back off, minimize stressors. That's a piece of this puzzle. Also doing the relaxation exercises consistently in a proactive way, right? Working on the hypoglycemic diet, working with the salt. Believe it or not, these are all kind of basic pieces of this puzzle, which help to prevent the over-escalation, because those are all jobs that your adrenal has. And when your adrenal doesn't have to do that, it can deal with other stuff. That said, I would utilize whatever kind of cognitive behavioral therapy techniques, breathing exercises, visualizations, or whatever. That stuff is really key. If we're looking towards supplementation, Seraphos is a good one. So for those of you who don't know, Seraphos is it's a group of phospholipids that helps modulate the HPA axis. It's pretty safe to use. I'll start with kind of basic dosing with that. At times, I will use higher doses, right? So with Seraphos, typically if a little works a little, more might work better. So, sometimes I'll kind of bump that dose just to test it out to see. That said, there are lots of things you can use to try to calm down that system. That's really just one of them. Some people will use, different forms of GABA support, right? GABA is that main calming neurotransmitter that tends to get beat up, right? Really beat up with stress over time. There are some gentle things to support GABA. L-theanine is one that is, it's just a simple kind of an amino acid that gets into the brain, and that has a calming effect on that system or augments GABA receptors. If you look on the internet, therapeutic dosing is anywhere from a couple hundred to 600 milligrams a day. Theanine's a pretty good one. But even the CBD or cannabis types of products, these things can be useful. Here in Pennsylvania, we can use CBD oil, right, which is the non-psychoactive part of cannabis as opposed to the THC. So sometimes I'll use kind of, testing out the different CBDs, and there's quality control issues. So you want to pick one because they all don't work the same, and strengths and all that stuff. But using CBD can help to kind of take the edge off there as well. Those are just a few. Really, Eva, though, it's the prevention, right? Your system's going to be trigger happy for a while for a variety of stressors. It's way easier to prevent that overstimulation and excitation than it is to kind of try to deal with it once it's there. So stick with that preventative side of things, and that will help, beyond anything else. Okay. Anita says, What do you recommend in treating mast cell activation syndrome issues? I've been diagnosed with SIBO and other autoimmune disease. My functional doctor has exhausted her knowledge base for helping me with these issues. Tired of running from practitioners to doctors and finding only glimpses of help. Many do not know how to put the puzzle together. Well, you just said a mouthful, Anita. That is probably the most common story that we hear with regard to adrenal fatigue and all the secondary and tertiary problems. So I want to take a minute to address that, and chances are my coaches and coordinators will probably yell at me for taking a little time for this, but it's important. When someone has a stress response system dysfunction, which is actually at the underlying core of everything you just explained, Anita, a stress response system dysfunction shifts our physiology. It makes our stress response trigger happy. Too much stress hormone causes a bunch of symptoms. All the symptoms we associate with adrenal fatigue: pain, weight, sleep issues, brain fog, anxiety, depression, even blood sugar, blood pressure problems. Every one of those symptoms is well documented to be connected to stress physiology. Doctors don't know what to do with the whole stress issue, so they'll give you a drug or an herb to cover up the symptom. Take this for your anxiety, take this for your sleep. I mean, if you're lucky enough to pick the right drug, you might cover up that symptom, but you haven't fixed the underlying problem. And it's going to perpetuate, right? Because the damage perpetuates. So chasing symptoms alone is like putting a little piece of tape over the check engine light in your car. Obviously, you're not fixing the problem. Now, what also happens, and if that's not confusing enough for everybody, let's make it more confusing, because you can also develop symptoms on this other physiologic side of this seesaw, because when your body internally is fighting tigers all the time, it's only activating a couple organs, the organs that would save you from that theoretical tiger. It's suppressing immune, digestive, reproductive, thyroid, and on purpose. And again, we know that is fact, that exists, that's conventional medical texts, it's there. And it makes sense too, right? Because you're fighting a tiger. You don't want to waste energy healing some inflammatory response or fighting some chronic infection. Forget about that. Deal with the tiger. Same thing with the gut. Shut it down. Don't waste energy digesting, absorbing. Don't want you to have a bowel movement right now, right? There's this tiger. Same thing with ovarian hormones, right? Shut it down, right? Shut it down. Don't care about your periods. Don't care about your sex life. Don't want you to procreate right now, right? There's a tiger. Thyroid goes the same way. Do that once in a while. It saves your life. Do it all the time. And now, depending on where you're susceptible, you're going to develop symptoms within those systems. Immune symptoms, inflammatory stuff, chronic recurrent infections, chronic sinus, postnasal drip, allergies is a big one, because you start to overproduce antibodies. When you're overproducing antibodies because of this, you can overproduce antibodies to anything, even your body's own tissue. And now we're looking at autoimmune disease. Excuse me, I've never had a patient with an autoimmune disease that did not have an underlying adrenal problem feeding it. What conventional and functional or alternative medicine, they don't necessarily pay attention to the why as much, right? They're trying to, well, your immune system's off. Let's fix your immune system. Well, why is the immune system off? It's because of this stress physiology. So to get to the autoimmune, you got to go through the adrenals and this stress physiology. Same thing with SIBO. I use this example. I had a woman come into me. I've got a sister clinic down the road, and they were treating this woman. She had SIBO multiple times. She's like, Doc, Dr. So-and-so is treating me for SIBO 4 times. I had 4 rounds of antibiotics to treat it. I feel a little better each time, but it comes back. I'm like, all right, let's find out why. Sure enough, talk about the rest of her history. She's got this other picture. She's got all these other symptoms. She's got adrenal problems. And I said, look, I'm going to ignore your SIBO, and we're going to try to fix this from the ground up. And we never had to chase after SIBO again. The gut normalized because we stopped suppressing it. We shifted that physiology, stopped suppressing these organs. Trying to fix these organ systems while your body is constantly suppressing them, it's like trying to push a car that has the parking brake engaged. It is a whole lot easier to release that brake. Okay, so briefly, Anita, what I ran over with or ran whatever, didn't answer was this mast cell activation syndrome is basically histamine issues. All my patients have histamine issues. I assume it in everybody. I don't consider it a thing in and of itself. It's a secondary, maybe even a tertiary problem. Again, allergic reaction. That's what the immune system does. Okay. There's lots of different natural antihistamines that are out there, right, that you could Google and find. I'm a little fond of quercetin, is kind of one of my favorites. Nice, safe, gentle. So quercetin is one of my favorites, which I will use in patients that show allergies or histamine issues. However, that's still a superficial treatment. We still got to fix that underlying cause, get that physiology to shift. That's really the key. Okay. Excuse me. Bob says, when do you know when to start tapering off of supplements? Okay. So it's a good question, Bob. And Bob's kind of in our program too. So the answer to that is it definitely varies. Overall, what we're looking at is kind of ramping up a protocol for patients, right? Little by little by little, getting this physiology to shift. How do we know this physiology is shifting? These symptoms tend to decrease in intensity, frequency, and duration over time. These systems start improving as well. These systems kick in, and now those symptoms start to improve. And then we get somebody stable. Then we keep them there. Because once this shifts, you're not healed. Once this shifts, you start healing. Now you heal. And it takes time. It takes many, many months. I typically will have patients on some semblance of a protocol, minimally 6 to 12 months for most patients. Not uncommonly longer. Because it just takes that long to fix this. Because for most of us, this condition's been around. As you go back through the history, and I talk a lot about this in my programs, on my YouTube channel, like, yes, there's probably that straw that broke the camel's back, right? That last stressor or two that really filled up the bucket, and all of a sudden this thing was stuck bad. But that's just the tip of the iceberg. This thing has been brewing for years and years, if not decades. If not decades. So thankfully, it doesn't take decades to fix it, but it also doesn't take a couple weeks or a couple months. Months over time. This physiology is good, functionally continuing to improve little by little. And just like I add supplements in one at a time, we decrease supplements one at a time. Take a supplement, cut it in half, see how you feel. Give it a little time. Give it a couple weeks. Stop it. How do you feel? A couple weeks. One change at a time. Go on to the next one. And then we just kind of chip away at those things. But it takes time. And honestly, what also happens is some patients, as they get better, they feel better, they do more, and then they forget to take stuff. And then they come back into me and they're like, Doc, I haven't taken this quercetin or whatever for like 3 months. I'm like, how do you feel? I feel okay. Yeah, no problem. All right, well, let's leave it out. Not the most scientific way to do it, but it happens. Okay. Amy says, and please, for those of you that jumped in late, give us your name. Tell us who you are, where you're from. We're always curious. Any comments, questions, please put them down in the comments section, because we respond, right? We respond. We're curious. Okay, Amy says, are menopause hot flashes really adrenal fatigue? Yes, 100%. How to combat them? Fix the adrenal fatigue. All right, so let's talk about it. In women, the ovarian hormones gradually decline. Somewhere age 40, 45, 50, they are going to gradually decline. That is a natural, normal process, not a disease state that's been going on for a long time for women, long before we had hormones to fix it, right? Well, what we also know is during that time of transition, the adrenals start to produce, or they increase their production of those same hormones. So here's something interesting. Your adrenals produce every ovarian hormone you have. And we didn't talk about a whole lot about that in med school. but it does. So the adrenals during that time start to increase their production of progesterone, testosterone, some estrogen. That is designed, I know now, to ease a woman through menopause without symptoms. If the adrenals are strong enough to come in and save the day. Anyway, postmenopausally, we test a woman's ovarian hormones, and a good amount of them are actually coming from the adrenals, not the ovaries. That is an incredibly important connection and that relationship between the adrenals and the ovaries. So when women talk to me about ovarian hormone symptoms or menopausal symptoms specifically, I'm always going back, that's an adrenal problem. That's not a problem with your ovaries. If the adrenals can come in and handle that stress. So during that time, that menopausal time, that's a period of added stress on the adrenals. And what you'll come to learn is that the adrenals do a lot of physiology in our body, and that's just another one. So how do you fix it? You fix the adrenal fatigue. Stick around, keep listening. The way to fix adrenal fatigue, which is really a problem with the whole stress response system, the hormone side, the nerve side, the limbic system in the brain. This is the mistake people make, is that not only do we chase after symptoms, not only do we chase after these secondary and tertiary problems, but we also might just chase after the adrenal gland. Like some doctors specialize in the adrenal gland. Hey, this is an adrenal problem. Let's focus on that. Well, it is, but not only. Some doctors will focus on the nerve part of the stress response system. And hey, you have dysautonomia. It's obvious, right? And it is, but not only. Some doctors will focus on the limbic system, even images, right? And how you have sensitization. You've got issues with your limbic system. That's the problem. And it is, but not only. So in order to most efficiently fix this thing, we got to put this puzzle together for you. And everybody's is a little different, some common pieces. We put enough pieces of that puzzle together to get this physiology to shift, right? Create space in this bucket for stress tolerance. That is what fixes adrenal fatigue. Now, I mentioned I mentioned hormones. I don't have a problem with bioidentical hormones, people using those for hot flashes, but they don't fix, they cover up the symptom, right? You're not going to see it, but they don't fix the underlying problem. And chances are, if you have menopausal symptoms, you probably have adrenal problems. And if you have adrenal problems, that is a big deal. It doesn't sound like a big deal, right? Because it's adrenal fatigue. My doctor doesn't even think it exists. All right, let's tackle that one. Your doctor knows that this problem exists. It's just the nomenclature that they don't get. Any doctor worth their salt knows stress causes anxiety. Stress causes depression. Stress causes weight gain. Stress causes blood sugar issues. Stress causes we know that. What they don't get to the point is, can we call it adrenal fatigue? The problem is there is no good name, no diagnosable condition for this. What it is a stress response system dysfunction, right? Controls most of your physiology, right? What doctors do is they have to put down a code, right? I'm going to put down the ICD-10 code for anxiety, depression. I'm going to treat that. And they treat those things as if they're the condition in and of themselves without some underlying cause. Well, there is an underlying cause. They just don't have time. Literally, they just don't have time to be able to deal with that underlying cause. Fix that underlying problem. That is really the key. Okay, Jackie Ann says, can you take Serophos for life, or would you want to wean eventually? Jackie Ann, I think you probably could take it for life, but if you needed it for life, then we're missing something, right? We're not fixing the underlying problem. It's pretty safe, right? Serophos is a very safe, gentle support and effective. HPA axis modulation, it's good. It's not a slam dunk for everybody, so don't freak out if it didn't work for you. There are other ways, and this is where the art of medicine comes in and figuring out what this puzzle looks like for everybody. But oftentimes, Serophos works to take the edge off. But the goal here is to fix the underlying problem so that you don't need the Serophos. And if you continuously need the Serophos, then we've got to do deeper work. together. I tell my patients, and I still see patients one-on-one. I mean, I have a variety of programs to treat this, but I'll still see patients one-on-one. And the idea is it's not the Cerephos that's a problem. It's great if it works. It's the need for the Cerephos. Just like coffee, right? You can pick somebody with adrenal fatigue off the street by looking at how they self-medicate, right? Well, I'm tired in the morning. I need coffee in the morning. I need some sugar or energy drinks, or I need some nicotine, or I need some alcohol at night to take the edge off, right? That's probably half the country right there, right? Adrenal fatigue. It's not the coffee that's a problem for patients. It's the need for the coffee. That's what we have to focus on. That's what we have to fix. Why do we need coffee? Because my body's been fighting tigers internally for decades, and I'm tired. All right. So, Tanisha says, if DHEA is a 30, could supplementing with it help my energy and low libido? Okay, so DHEA is an adrenal hormone. It's the other major adrenal hormone. In fact, DHEA doesn't get the press that like cortisol, estrogen, testosterone gets. Not quite as sexy as those. But pound for pound, we actually have more DHEA in our body than we have any other hormone. It is incredibly important. There's two patterns in our life with DHEA, age and stress. The age pattern is DHEA is highest when we're young. It actually initiates puberty. Adrenals mature, release some DHEA, trigger the testes and ovaries to mature. Highest in puberty, nice and high, teens, 20s, 30s. After age 40, it starts coming down. Test somebody in their 70s, they got about a quarter of the DHEA they had when they were 20. The other pattern is stress. DHEA goes up with cortisol, with stress, but then you can run out, right? So it can be depleted. There are two ways to test for these hormones primarily. You can test it in the blood, and you can test it in saliva or urine, whether we're testing your total hormone or more your free hormone. I'm not sure what a DHEA of 30 means. By your question, I'm going to assume it's low. I tend to use saliva tests. My range is like 3 to 10, that I know. So if it's on the low side, the question is, could supplementing with help my energy and low libido? Maybe, but not only. If you've gotten to the point where you've depleted your DHEA and it's low or low normal, there's a ton of other problems that you have. Because what that means is your body's been in stress physiology. You've been through the earlier stages of this condition. You are now moving through the middle stage, depending on where your cortisol is, even into the later stage of adrenal fatigue. I'm not against supplementing with these hormones, but you can't kid yourself and think I fixed the actual problem, okay? There is a whole lot of other problems. That means your stress physiology is kind of broken. It means you've been through the earlier stages of adrenal fatigue, which is where all the wear and tear happens. This is where all the symptoms come from. Tremendous damage happens in the body when we are in fight or flight, when we're fighting tigers all the time. The body has to exhaust, if you will, like a car's exhaust. The metabolic exhaust of fighting tigers all the time is free radicals. Free radicals are little electrophilic molecules that cause damage, like pinballs in an old school pinball machine. They bounce around, nicking and damaging tissue. And these free radicals are in the blood, and the blood goes everywhere. So the damage is literally everywhere, head to toe, inside and out. That's why these symptoms are so kind of diverse. Medically, we refer to that as oxidative stress. And if you Google oxidative stress, it is connected to every single chronic disease you can think of. Neurologic diseases, cardiovascular diseases, immunologic diseases, all of them. Biggest way we engage in this oxidative stress is stress physiology over time. That whole system has to be fixed. You can't take just DHEA and fix all that, right? You've got to hit this in a holistic, more comprehensive way. And I'm not trying to make this kind of too difficult, but it is. Like, the concepts are relatively simple, but it is complex, because this physiology hits your whole body. Your whole body is connected to this. And it gets confusing because it's like, well, what about my SIBO? What about my thyroid problem? Well, the number one cause of low thyroid in this country is going to be stress physiology and adrenal fatigue causing it. You can't possibly stabilize thyroid if you still have the adrenal problems, right? So there's kind of a lot more to this than people talk about. I mean, adrenal fatigue is a little more popular these days than it has been in the past. So a lot of people write the same old generic stuff out there. Take some vitamin C, take some ginseng and ashwagandha, you'll fix your adrenal problems. Yay. No, it doesn't work. Unfortunately, it just doesn't work. It's more than that. Okay. Nina says, can you please talk about the best thing for brain fog? Sure. Fix the adrenal fatigue. Brain fog is a very common symptom associated with stress physiology, free radicals, oxidative stress over time. Dump a bunch of stress hormone and free radicals in the brain, you will have anxiety, depression, memory problems, focus problems, word finding problems, insomnia, right? So brain fog is up in there. Brain damage. Fixable brain damage, but that's what it is. I have used, and it's a frustrating symptom. I get it. I mean, I had that same symptom. Very frustrating. I have used, 100 different products to try to specifically target the brain fog. Not one of them has ever worked consistently for everyone. What has worked consistently for everyone is to shift this physiology, stop the damage, turn on this other side of our physiology, right? The healing and the rest and digest side, which is where we heal and repair. And little by little by little, that brain fog goes away and you get your mind back. This is kind of a key point. When we shift this physiology, right, we start turning off the wear and tear that comes from stress physiology. And I give that physiology a bad rap all the time because of all the damage it causes. But it's life-saving. We have to have that physiologic state. We just don't want to do it too much because of all the damage. When we shift this physiology, we turn off the wear and tear that comes from fight or flight, and we end up turning on what we call rest and digest physiology or parasympathetic physiology. It is during that physiologic state that we turn on the healing and repair deep within the cells. We turn on those functional physiologic processes of healing and repair. Let's get some waste products out. Let's build some proteins, right? We turn on the genetics of healing and repair. Because we're reading a whole different genetic blueprint when we're in fight or flight. That's survival mode, right? Battle. Well, you change that physiologic state. Well, we don't need that physiology. Turn those genes off, turn some other genes on that can heal and repair. That is ultimately really the key. So I don't have any big slam dunk, hey, take this Dr. Neville's special brain fog formula. If you see something like that on the internet, run. It just doesn't work. It doesn't work. But you can fix it. So it's not that you can't fix it. You just got to fix it you got to tackle it in a more comprehensive way. Okay. Oh, I'm not a downer. Come on, I just want the vitamin that'll fix all this stuff. And I get it. I wanted the vitamin too when I was struggling and I tried lots of them. Doesn't work that way. Michelle says, any correlation between adrenal fatigue, H. pylori, BV, and perimenopause? Well, Michelle, go back to my earlier conversation about perimenopause because I explained that whole thing. 100% perimenopause, menopause. H. pylori is GI infection. I would consider both H. pylori and BV. BV is a vaginal infection. I would consider those what I would call opportunistic infections. Not what I would call, I didn't make that up. That's what we call an opportunistic infection. There are plenty of patients that if you test their microbiome, right, their GI bugs, they will show positive for the genetics or for strains of H. pylori. Many. But not all those patients have infection or have symptoms or have reflux or have ulcers, right? That's the new thing, based on the germ theory. we're so thankful we could find H. pylori in ulcers. Now we think that H. pylori causes ulcers. It's an opportunistic. There are plenty of patients who test positive for H. pylori who do not have ulcer, and it's not a problem. It just happens to be there. So it's a piece, but a small piece. So very strong connection. As far as BV goes, again, opportunistic, right? When we're in stress physiology, I'm not going to get into it too much, but that physiology changes the pH in the vaginal vault, makes women more susceptible to those kinds of issues. Shift that physiology, and that can improve. You add to that stress physiology suppresses ovarian hormone function. That affects the vaginal vault even more, that pH. So there are deeper underlying causes, so 100%. Okay, Linda says, I have chemo-induced dysautonomia, orthostatic hypotension. I take fludrocortisone, midodrine, and other meds. Does this mean my adrenals were infected? Feel like I'm in a constant state of fight or flight. Maybe. So people will ask me this, like, Doc, I have anxiety, or Doc, I have insomnia, or I've got IBS, or whatever it is. Do I have adrenal fatigue? Maybe. What we have to do is we have to look at more holistically at the rest of your symptomatology. What else do you have, right? And what else have you struggled with over the years? Because sometimes it's like, well, I developed IBS here, right? But what about 5 years ago? Didn't you have sleep problems and anxiety and chronic allergies and immune stuff, right? And when we start to see that combination of all those symptoms, it's much easier to say you probably have adrenal fatigue. In fact, on my website, we've got an assessment tool where you can kind of plug in your symptoms. It's quick, takes 4 or 5 minutes, spits out the likelihood of you having adrenal fatigue or not, and some articles and resources as far as where to go and how to learn more about that. So it's the whole picture which tells us whether or not you have it. What you have is dysautonomia. So we know, depending on where the chemo hit, it affected your autonomic nervous system. Fludrocortisone is an adrenal hormone, right? Or a mimic of an adrenal hormone. That's aldosterone to help you to hold on to the salt. So those things are designed to help. So I'm going to say, Linda, chances are you're dealing with adrenal fatigue, especially if, let's go pre-cancer, pre-chemo. If you have any history of these symptoms that we've been talking about, and you happen to have cancer in addition to that, that chemo, right, was the straw that broke the camel's back, and now that thing is kind of stuck. When you're in a constant state of fight or flight, with my patients, they talk about it in those terms all the time, so it makes perfect sense. That's bad. Not only is it incredibly uncomfortable, right, but physiologically you're here, right, which means causing damage, not healing and repairing. So this has to shift. I'm okay with meds, fludrocortisone, those kinds of things. They don't fix the problem, but they can deal with some symptoms. But chances are there is a deeper underlying problem. And I've said that there's there are ways to figure out this puzzle, things like that. If you're curious and you just want to reach out to us, by all means you can, because I will still work with patients one-on-one. I've got a handful of different programs that I will use to treat this these days. Each one of those programs is based off of the success we had with patients who used to come to stay with us. Got a guest house at our clinic, and people used to come for a couple weeks, couple months to stay with us to get treatment for this stuff. And by the time I would send those patients home, they'd already be feeling better. You don't fix this problem in 8 weeks, but they can feel that shift and they kind of know they're on the right path. And by the time they leave, they've got a plan, an understanding of the plan. They got tools to implement the plan. So not only would they feel better quicker, but they would stay better longer. And to me, that's what healing is all about, right? It's understand what you're dealing with, get ahead of it, know how to manage it, and then just go live your life. Stay away from as many doctors as you can. including me. All right, so the problem with that is most people don't have the resources to come and hang out with us for a couple months and get that level of care. So I've created a handful of programs to deal with that. The main one, kind of the Cadillac of what we do, is this all-access program, which is one-on-one with me, lots of contact, which is kind of essential to expedite that process. That is the most effective, fastest way to get ahead of this. Some people can't do that, so I've got a couple step-down programs. If you have any questions about that, reach out in the comments, reach out to us. I have patient coordinators that will talk to you free consultation, and see kind of what fits, what makes sense, if you're interested. Okay, Dasha says, I'm 46, going through perimenopause. I've been experiencing sick feelings in the morning and throughout the day, almost like blood sugar is dropping, probably. Sometimes can't function after eating. Things seem better. Check my sugar a few times a day, normal. Had a bad episode this morning, sugar, also experiencing dizziness. Tried hormones, made me sick. Lab work, MRI, normal. Doctors don't know what to do. Sometimes tired, not like myself. Please help. Thank you. So Dasha, the best way to go with this, Dasha, is to reach out. Like I just said to my patient coordinator, reach out to us. You can talk to my patient coordinator. My patient coordinators are some of the most compassionate, the easiest people to talk to, and they can kind of make some sense of this. But what I would suggest is if there are other symptoms, right? You've got the perimenopause, you might have hypoglycemia. It's not going to show up on your blood work because it's probably reactive hypoglycemia, like lots of my patients have. With this combination of symptoms, oftentimes it's that whole, like if it looks like a duck and walks like a duck and quacks like a duck, chances are it's a duck. The problem is your conventional doctors, they look at it through this microscopic lens. They kind of have blinders on, right? They're looking at, well, your blood sugar's fine. You don't have true hypoglycemia. Well, true hypoglycemia is an incredibly rare liver condition, incredibly rare. What all my patients have is reactive hypoglycemia, and it's not going to show up on one of those tests, but you can feel it. And what you want to do is you want to listen to your body. Your adrenals control your blood sugar. That's what they do. So anybody with an adrenal problem is going to have this reactive hypoglycemia. So you probably do have it. Reach out to us and touch base. Okay. So Jackie Ann says, if I have low DHEA, is that what's causing me to feel tired all the time, even when I sleep well? Yes and no. Yes and no. Energy, right? Our ability to have energy, it's multifactorial. Is DHEA a piece of it? Yes, but not only. There's a whole lot more that goes to the creation of energy. Much of the fatigue and the energy problems in my patients are mitochondrial problems. So the mitochondria are the little energy producers in all the cells, right? The mitochondria in the cell, take you back to your high school biochemistry, biology class. Mitochondria take energy from food, turn it into a universal form of energy called ATP that we can use to do stuff. Anything. Think a thought, move a muscle, detox, build a neurotransmitter. It's all dependent on ATP. That mitochondria is very susceptible to damage from oxidative stress. If you remember oxidative stress, I know it was 15 minutes ago, but oxidative stress, free radicals, metabolic exhaustive stress physiology, damaging mitochondria. So chances are it's a bit of mitochondrial damage, which we can repair. We always pay attention to it. Again, there are some doctors, they specialize in mitochondrial problems. They're like, aha, you're tired. You have mitochondrial dysfunction. And I say, yes, but why? Or yes, but not only. Right? You can spend a lot of money taking all these mitochondrial supplements, right? Fix this. This is good for it. Fix all this stuff. Lots of stuff, and you'll sell lots of supplements that way. But if your physiology is still here, you're continuing the damage, right? So you're never going to fix the problem. You'll have to use those things forever. Yes, I pay attention to the mitochondrial problems, but let's fix the problem. Like, let's fix the hole in the boat instead of bailing the boat, right? Okay. My crew is yelling at me because I have 15 minutes left and a lot of questions. All right, I get it. Carol Ann says, what are the best steps to take to begin healing adrenal fatigue while pregnant? Are any of the regular steps towards healing should be done differently while pregnant? Yeah. I mean, pregnancy throws off everything. So the basics. I've got a basic Jumpstart program that's really good. That starts talking about these basic steps, which are really important. You want to get a little deeper to that. Beyond that, I've got a core program, right? Which again, you get much more information, expands upon the basics, and then some. It's all about that stress physiology. The big thing with pregnancy is you got to be careful what kind of supplementation you're on. Some supplements for adrenals are okay for pregnancy. Some you want to be more cautious. So that's really the key. But absolutely start with the basics. Okay, Pamela says, in all my years of research in quotes, adrenal and thyroid issues are often mentioned as working together, as in you can't heal one without healing the other. Does your treatment plan address healing thyroid issues as well? Yes and no. I used to think of the adrenals, the thyroid, and the ovaries as a three-legged stool, right? The hypothalamus pituitary controls those three. They all talk to each other. They work together, three-legged stool, right? I was wrong. As goes the adrenals, so too will go the thyroid and the ovaries. We know specifically that stress physiology and stress hormone suppresses your hypothalamic pituitary ovarian hormone axis and your hypothalamic pituitary thyroid hormone axis. The number one cause of thyroid problems in this country is stress physiology and stress over time. You have to treat the adrenals first. Do they work together ideally? Yeah, they do. They work together ideally, right? But you can't fix the thyroid unless the adrenals are balanced out. And this is one of the biggest problems that's out there. Will I address the thyroid? Yes, but guess what? A lot of times I don't have to, because when we shift this physiology, now we're not suppressing the thyroid all the time. Now it can kick back in on their own. I've had people medicated for thyroid for years, shift this physiology, stop suppressing it. Now they're hyperthyroid. Now they got to reduce their medications over time. Start with the adrenals. Okay. I get why the research would show that, and I get that they do work together, but the adrenals fall apart first and cause the problem. Fix that. You might not have to go after the thyroid. Okay. Dustin said, is healing possible for someone with dysautonomia who was triggered by bumping the head in a car accident? I have OCD, years of chronic stress before the accident. The accident was the trigger that full-blown dysautonomia. Yeah, absolutely. Absolutely. So again, the stress response system is the hormone side, the autonomic nervous side, and the limbic system side. If you look at the treatment, right, for traumatic brain injury, concussions, things like that, that treatment is kind of similar to some of the treatment we talk about with regard to the adrenals. And you look at the symptoms, right? These people need kind of calm and support and decreased sensitivity, right? And all the symptoms that come alongside of that. So there's tons of connections. Stress physiology itself is a form of kind of damage to the brain, just like a concussion would be kind of damage to the brain. That is all reparable. And the most success I've ever had is healing all of it, right? Is healing the hormone side, the nervous system side, and working on the brain all at the same time. That's when you can get this physiology to shift. So 100%. Michelle says, I feel like I'm doing all the things: supplements, grounding, breathing, meditation, gut health, saying no, healthy eating as best I can, and I still have internal anxiety. So you're right to recognize that internal anxiety as a problem, and you do have to get after that. So as I'm working with patients, it's all about calming that system first before we can kind of successfully support somebody and ultimately fix this problem. So it's all about calming. Now, the challenge with that, Michelle, is that our limbic system is really good at stress physiology, way better at stress physiology than anything else. So we're up against it, right? we have to make heroic efforts at turning on the parasympathetics. And that could be breathing, could be meditation, could be nature, vagus nerve exercises, whatever it is. Not the cold plunge. The cold plunge fad is not good for this condition. I just want to step out and say that. There are certain supplements that can help to calm that down. You've got to eat a hypoglycemic diet. We've got to do the salt stuff. So there's a lot to this. And I don't know. I haven't seen, I field patients every day, right? And I hear the stories that they have from their other doctors. Conventional medicine, whether they didn't listen to them or they were, just discarded or told them it was all in their head, or alternative medicine, functional medicine, those doctors are usually nicer, but they chase after some of these secondary things. Even those doctors that believe in adrenal fatigue, they might test for it and find it. What I've learned is that they just grabbed a hold of a tail of something that's way bigger than they anticipated, because it's bigger than just a problem with your adrenals. It's all of this together. And honestly, I don't know anybody else out there that treats this as comprehensively as we do. So if you're struggling, right, despite kind of trying everything, which is something I hear all the time, if you're struggling, there are missing pieces of your puzzle that you need guidance to find, right? And it's not that your body can't heal. It's not that you failed the treatment. It's that treatment has not kind of fully fixed you. The treatments have failed you, not you have failed the treatments. Doesn't mean you can't get better. It just means there are missing pieces. And sometimes, it can take an expert to try to figure that out. All right. Good luck. Melissa says, if someone's been diagnosed with endometriosis, will they usually have adrenal fatigue issues as well? So generally, yes. With adrenal fatigue, you get estrogen dominance. Number one cause of estrogen dominance, right? Estrogen high relative to progesterone. And that causes all kinds of symptoms: PMS, heavy bleeding, ovarian cysts, fibroids, endometriosis, right? I can't think of a patient that I have seen with endometriosis didn't have an adrenal problem at the underlying cause. So yes, we've got to fix that. That's the big thing. You got to fix that adrenal problem, because you can't keep all that stress hormone messes with that whole axis, which is not great. Becky says, what are your thoughts on mind-body work? As in, when you're being told that you need to live life as if you're not broken, like the work of Sarno. Also would love to hear how your adrenal fatigue was when you had it. P.S. I'm one of your patients. And you're great. Thank you. I've seen minor improvements after a few weeks. ! Love to hear it, Becky. Okay. How's my time? So I'm familiar with Sarno work, John Sarno's work on TMS, tension myositis syndrome, and his effort. And it's interesting. I think different things work for different people, right? And I'm not going to get too much into his work. People can just Google him and kind of take a look at what it is. What I have found is that for the vast majority of patients, when we treat kind of in the way that we are and go after kind of the nuts and bolts of this broken stress response system, which means I do ask patients to pay some attention to their symptoms, what triggers what, right? Because there are a variety of things that this stress physiology has to manage, and we do have to pay attention to and learn, how much is too much, how we should eat, how much salt do I need. So I want patients to pay some attention to symptoms so that we know where to intervene, but not so much attention to symptoms where, we're just flat out ignoring it. And that's kind of what, Sarna says, we'll just, throw away your crutches and don't go to PT and just don't focus on it and you'll be better. I mean, that happens in some people. The vast majority of the time, though, I don't go in that direction, and my patients get better. As far as my story, it's a longer conversation. Since you're a patient, we will have that conversation over office hours. I'm going to save it. I'm going to save it for that because I'm going to get to some of these other people. But thanks for sharing, Becky. Can you explain how adrenal fatigue can cause hypoglycemia and what can be done? Adrenal fatigue causes hypoglycemia because that's what cortisol does. Cortisol raises blood sugar. Pure and simple, that's its main job. If you've got an adrenal problem and your cortisol is a problem and it can't raise blood sugar, your blood sugar is going to drop. Hence hypoglycemia, right? I mean, it's fairly basic. So the way people need to eat who have adrenal problems is a hypoglycemic diet. Okay, that's how you fix it. So small, frequent meals, more protein, fat, low sugar and carb. But here's the thing, Jen. You shouldn't have to micromanage your diet that way. Most people who don't have adrenal problems, their blood sugar drops. That's a minor stress. The body generates a minor response, and either they sleep right through it or they don't. It doesn't matter. It's not a big deal. So if you have hypoglycemia, then you do have an adrenal problem, which means you have a stress physiology problem, right? Which means there's a whole lot more that has to be fixed to get after it, if that makes sense. So yes, you want to eat that way, but that is only one piece of this puzzle in fixing this physiology, which takes time. So basically that's it though. Okay, how we doing? 4 minutes. Misha Ann says, if cortisol levels are heightened at night, they keep adding questions. I'm not going to get to all these questions. If cortisol levels are highest at night, how is that corrected so those levels are lowest at night like they're supposed to be? Okay, if cortisol levels are highest at night, that's a problem. That means your stress response system is broken. So for those of you that you don't know, when we're working with adrenal problems, we want to get saliva testing, which gives us 4 points throughout the day. Cortisol creates our circadian rhythm. Highest in the morning, then it gradually goes down throughout the day. It should be its lowest level in the evening when we go to bed. By the way, newer people that have joined, tell us who you are, tell us where you're from, right? If you have any questions, concerns, put them in here in the comments. We'd really love to hear from you. So that circadian rhythm, right, should normally naturally just occur because our body is in balance and that's where it likes to be. Stress hormone over time messes with the HPA axis. That cortisol rhythm will get thrown off. So ultimately, there's no magic answer to fix high cortisol at night. The magic answer is, how do we put enough pieces of the puzzle together, your puzzle? How do we put enough pieces of that puzzle together so that we shift this physiology, so that we stop causing all the damage, we cause the healing and repair, and that's what ends up balancing out those cortisol levels. And then, symptoms go away, things like that. That said, look into Cerephos. Cerephos is pretty good at blunting cortisol. Start with a low dose and play with that a little bit. But that is one minor piece of doing everything. Okay. Catherine says, hi, Dr. Neville. I'm seeing consultation tomorrow. Lumbar pain, spinal canal stenosis. He may offer me steroid injection. During our chat, you said cortisol levels are very high. Recommended Cerephos. I reckon it may be detrimental to my recovery to have steroid injection. Feeling anxious. Thoughts would be appreciated. Okay, so I've got to give you kind of general advice with that. Doctors like to throw steroids at people. Steroids for like a disc bulge or a stenosis, I'm not like thrilled about because it doesn't fix anything. Like you're not going to feel the pain, but you're not going to fix the stenosis or the bulge, right? I would rather see somebody kind of go after like, how do I fix this actual problem, right? Not surgery necessarily, but how do I do PT, those kinds of things. That said, if somebody's has bad enough issues, then okay, you can hit them with steroids. It's not going to fix anything, but maybe you'll be out of pain for a month. Maybe. It'll be a little hit to your adrenals if you do it. It's okay. It's recoverable. You can recover from that, right? So that's all right. That's all right. I tend to, I don't know. All doctors have opinions, right? And I think we should act as consultants to patients. Really, I've got my take and my bias on this stuff based on the research I know, and they've got theirs. I mean, that's what they do. That's the playbook, right? Disc bulge, spinal stenosis, steroids. It just doesn't fix anything. So, okay, I'm still under the wire. I'm going to go to Melissa. Can issues with my adrenal gland be corrected permanently, or will this be a work in progress for the rest of your life? Yes, you can fix it permanently. I encounter stress every day. Yeah, and that's fine. Is stress the main contributor to the issue? Yes. If I was diagnosed with other issues prior to treating my adrenals, how do I know if the problem is actually attributed to my adrenals and not a separate issue? Depends. Just makes sense. Look at the research. Talk to an expert. We can figure out what that is. If I follow your program without having saliva test or one-on-one conferences to determine the acute components of supplements I'm taking, will the program be effective, or am I just arresting a small? So it will. It will. I have one of the most frustrating things for me was that, as I've described this whole time, is that this issue is complex, right? Figuring out what this puzzle is, right? In my experience, the best way to do that is with frequent contact with patients from me. Well, that's a lot, right? So the all access program, that's a 12-month program if needed, right? Out to 12 months, multiple kind of one-on-ones through that. I touch base with every 2 weeks with patients throughout that whole process as we're tweaking this puzzle. Yeah, that's the best way to do it, but that comes with a higher price point. The next program is coach driven. Okay, so it's not me, but it's my coaches who I've personally trained who are exceptional at this. That comes with a test. Test is good. That's a 6-month program. Again, touch base every 2 weeks throughout the process. That's the next best thing. And people absolutely can get better with that program as they get better with this all access program. There's just a little more support as we kind of go up, right? The next step down is this core program. And with the core program, it's the information. It's the information and guidance. And I don't like the fact that somebody doesn't have, a couple $1,000s to spend, and so they can't get treatment. That would drive me crazy. So just this year, I was able to produce, well, it's taken a few years to put this together, but I was able to launch these other programs, Core and Core Plus, to help to be able to get the information to people at a lower price point. The core program is the information, self-paced, right? But I have documented all the advice I've given to my patients over the past 20 years who used to come and stay with us. I've recorded all that, right? So I've got videos on all that stuff. I've got documentation and recommendations. I've got explanations of how people should heal, what healing should look like. You calm first, support second, all the expectations to try to meet those. When people follow that advice, people get better. Now, is getting testing better? Yeah, getting testing is better, but that's a good place to start. And by the way, you can always upgrade if you wanted to, right? So testing is better as well. And is, the support helps, of course, right? But some patients don't need support. You know how some people they'll buy a gym membership and then they go to the gym every day, right? Not just in January, but in, July and in November, they're still going to the gym. That's great, right? Like some people are like that. Just give me the information, tell me what to do, I'll do it. A lot of us, otherwise, we need support, right? We need support and guidance. We need that personal trainer, right? To be able to motivate us, to hold us accountable, to be able to explain things, to be able to guide us through this, right? And we're all different. We just want to take a kind of an honest reflection of who am I and what can I do? What can I do on my own and what do I need help with? A lot of people need help. But you absolutely can heal. Doesn't matter where you start. Just start. Okay, so we ran a couple minutes long, and I don't know, probably not. I got closer to finishing all the questions. I apologize if I missed your question. By all means, keep reaching out to us. If you want to talk to somebody directly, reach out. You can set up an appointment with one of my patient coordinators. They'll talk things through with you. Check us out, right? Check us out on YouTube. If you have any other questions or concerns, let us know. Save it. I will do these. We're trying to do these every 2 weeks to be able to kind of demystify this incredibly frustrating condition. But there always are answers, right? And I'll share this last thing with you. One of my favorite quotes is by Mark Twain. And he said, "It's not what you don't know that gets you in trouble. It's what you know for sure that just ain't so." Now, I know that a lot of you have been told your symptoms are because of you're toxic, you have candida, Epstein-Barr, Lyme, chronic infections, mold, parasites, all those things. I would challenge you to think differently about those things. Do those things exist? Of course. But could they just be secondary problems to this underlying physiologic problem, which is creating slow detoxification, can't fight infections well, all that other stuff. So I would challenge you to think outside the box a little bit as you go through our information. All right, I'll jump off. Take care. All my best. Bye now.